What are alternatives people should look to?
So one of the cheapest alternatives you have available is it's in your diet. Holistic, basically homeopathic, like fish oil, turmeric, and ginger. Those are three very natural anti-inflammatories you can take on a daily basis. They're very powerful in being very natural anti-inflammatory to help stop the aches and maybe the inflammatory cascade you were talking about, where the joint is undergoing damage. So that's a great thing to start. And then now we're using what's called PRP, where you take your own blood, you spin it down a little bit, and you get the good juicy growth factors, and then you inject it along maybe with a joint lubricant. That has been extremely powerful in eliminating inflammation and helping possibly stop this cascade of the destruction that's going on basically, and help nourish the joint. That has been very well proven and very well noted in the literature now. In fact, when I had my surgery, I had that done to myself. So ever since my knee surgery about a year ago, every 3 months, I'm actually getting that injection done in my knee. And it's been very, very helpful with my recovery.
You highlight something so important, though, with osteoarthritis. Once you lose that cartilage, it's gone. So prevention is so very important. I take a turmeric supplement every single day. And I think if people also develop a problem in their joint, addressing it sooner rather than later, because that cartilage destruction as it continues just gets worse and worse and worse. Controlling your weight is important.
So much weight is so important in orthopedic issues, but I hope people are listening out there, because this is a very, very powerful message that if somebody is recommending steroid injections into your joints, just say no. There's too many.
Because they're still recommended by many.
I think it's hard, though, because sometimes, PRP injections, while very effective at this point, are quite expensive, right? We're talking about $500 to $750 a pop. Many insurances, in fact, the vast majority, don't cover them. If you start taking a bunch of supplements like turmeric and fish oil, and those things can also be anticoagulants. So you do want to make sure that you're checking what else you're on, that there are no interactions. So is there ever a place, Dr. Melamed, where you think, like an older patient or someone who doesn't have the financial means to do these other alternatives, do you think there's ever a role for steroid injections?
Yes, look, I think there has to be an informed consent. You have to let the patient know that the harmful effect of the steroids. If somebody's extremely debilitated and, as you said, don't have the financial means, and they're not even a candidate for surgery, sure, you want to help that patient, help their quality of life, to help them with the pain, sure. But as long as you have to tell them that, you have to tell them the possible side effects and what is going on, sure. No problem.
I was going to say, in the one case, if you have no cartilage left at that point, if the steroid injection improves pain, the joint's already destroyed. I could see if you're towards the end of your life and you're in pain and that's going to help decrease pain and you don't care. But otherwise, Drew, to me, if you have your life ahead of you, I just don't understand. Your joint's bothering you a little bit. Why would you risk it?
Exactly.
Right?
Correct.
That's the message.
The good news is, how's your joint feeling now?
A plus.
A plus.
Strong like bull.
And Dr. Melamed, you know what's funny is I always say we're not only doctors, we're also patients. Dr. Melamed, how's your knee?
Well, my knee's coming along very well. I'm at a year out, and I had a great surgeon that did the operation, and I use my bone marrow too. That's another thing. That's an off-label use of FDA approved. They spin down my bone marrow and they inject it. And it's amazing for the healing. And I'm getting every 3 months the PRP injection, as we're talking about.
So
and it's been
you didn't get a replacement, right, Doc?
I had a cartilage transplant done.
Okay.
Which was, with the use of the bone marrow and the PRP, it's really helping the cartilage recover and regenerate very nicely.
Well, Dr. Melamed, always appreciate your input, my friend.